We are presenting the procedure for a Combicath. This procedure takes 2 people. I'm Libby. Hi. We are presenting the procedure for a Combicath. This procedure takes 2 people. I'm Libby. I will be videotaping. Laura will be performing the procedure with sterile technique, and Stephanie will be assisting her with the non-sterile part of the procedure.
So say you're going.
Or you could just... How do you know when it's recording?
Because it's red.
Oh, it says it.
See, in there, like, watch, the minutes go down.
What does that little white button do? Or that little gray button?
That just moves it.
What do you mean moves it?
Okay, first we're going to have our, well, we already have our gloves on. We'll just say our gloves are already on. And then, first, we're going to get the bronch adapter and hook that up. Are we actually doing this?
No.
Okay, just make sure.
I have my whole thing to do, don't I?
Yeah, you have your thing to do. Then we're going to hyperoxygenate him by pressing the 100% suction button on the ventilator. And we're going to get our syringe ready. Okay, so we're good.
Oh, you were still recording.
Okay.
I'll set these on the bed.
Once I pull the sample out, that's when I can say something. That way I'm not like the silent partner. That way you don't have to do...
Yeah.
You can do all the intro, and then once I
when
push it in...
You'll say, I push this in as hard as I can.
Okay, so that way I'm saying
And mention
what I'm
that you're
doing.
going to feel like a big resistance.
Yeah.
Okay.
Okay. You want to hold that paper? Oh, you got the paper? Oh, it's recording right now.
Oh, we'll redo it. Yeah, I guess. Hi. We are presenting the procedure for a Combicath. This procedure takes... Hi. We are presenting the procedure for a Combicath. Laura! Hi. We are presenting the... Jesus. Hi. We are presenting the procedure for a Combicath. This procedure takes 2 people. I'm Libby. I will be videotaping. Laura will be performing the procedure with sterile technique, and Stephanie will be assisting her with the non-sterile part of the procedure.
This procedure can only be done with an artificial airway. First, we're going to get the swivel adapter and hook that up between the ET tube and the suction catheter. Then we're going to get our syringe ready. We are going to draw 20 cc's of saline and then 10 cc's of air for this procedure. I'll take the needle off. This goes to Stephanie. Then we're going to make sure we hyperoxygenate the patient by pressing 100% suction on the ventilator and lay out our sterile drape. Now I'm going to put my sterile gloves on. And making sure we keep the catheter sterile. Oops, did that come off? There you go, just push it back in. I can fix it when it comes out too if you want. There you go. Oops. Okay. Making sure we keep that sterile. This is our catheter. We're going to open the port and stick the catheter down in. And we're going to push the catheter in until we meet resistance. And when we meet that resistance, we are going to, I feel the resistance, I'm going to pull back about 3 centimeters. Now I'm going to take this off and advance the inner catheter the rest of the way. Okay?
Now I'm going to put our syringe on the end of the inner catheter, and as I'm advancing it, I'll meet quite a bit of resistance. It's not easy to push it in because of the pressure from the air, and then immediately I will draw back on
Our
the syringe
sample.
to get the sample. Now we have a small amount of pink frothy fluid in here, and I will open our sterile sample container and place our sample in there. Seal it, and now I will label it appropriately with our patient's name.
Meanwhile, I'm going to suction the patient to get that fluid out that didn't come up with the sample. And then, of course, it's always important that we listen to the patient after we do this procedure to make sure that the breath sounds are still equal and bilateral, since we've been altering the tube.